Hello, I'm Dr. Palani from the Urology department at Sengkang General Hospital. In this video, we will explain to you what to expect when you have a ureteric stent. A ureteric stent is used to bypass a blockage in your kidney or ureter. Common causes of such blockage may include a kidney stone, a ureter stone, and after surgery or instrumentation of the ureter and kidney. The placement of the stent used during the stone removal surgery allows the urine from the kidney to drain normally into the bladder. A urologist or a trained specialist will insert your stent in the operating theatre. In the procedure, you will be given a general anesthesia to make you comfortable. A special instrument called a cystoscope is passed along the urethra into the bladder to allow the doctor to see the opening of the ureter. The ureteric stent is then passed into the ureter such that the top end will be in the kidney and the bottom end in the bladder. If your stent only needs to stay for a few days, we often use a stent which has a thread which is attached at the lower end and that hangs out from your urethra, which will aid easy removal. After the procedure, you'll most likely be able to go home on the same day. While the stent is in place, up to 80% of our patients may feel some minor discomfort. These are called stent symptoms. These may include flank, groin, or back pain due to the stent. This is more noticeable after you pass urine. You may also experience burning sensation during urination. Certain movements may trigger this urgency sensation, which is a feeling that you may need to urinate quickly. Your urine may also look tea-colored, slightly pink, or even red. These symptoms will go away a few days after the stent is removed. Increasing fluid intake can help reduce the amount of bleeding in the urine and reduce the risk of infection. You may be prescribed some oral medication to ease the stent symptoms. If the stent has a thread coming out of the urethra, do not pull on it. The stent will need to be removed within 2 to 6 weeks unless you have a long-term stent. Your stent needs to be removed under local anesthesia, where a numbing gel will be placed into your urethra. A small flexible telescope will be passed along your urethra into your bladder, and the stent will be removed completely. If there is a thread attached to your genitals, it will be pulled out together with the ureteric stent. If you experience any of the below, please seek medical attention at the emergency department or return to our clinic by 4 p.m. on weekdays. I hope this information provides you with a clearer understanding of what to anticipate when you undergo a ureteric stent insertion. Thank you.